Getting sick happens to us all. Most of the time, we receive the medical care we need and get better. Sometimes, though, seeking medical treatment can make people physically worse. Doctors, nurses, and other medical professionals who are there to help occasionally make errors that cause harm.
Well, medical errors are now the third leading cause of death in the U.S.
Up to 350,000 people die, and nearly 1 million people are harmed each year in the United States because of medical error. Healthcare is a complex system involving teams of people using computers and technology to perform procedures, share information, and coordinate activities to treat patients, often in an environment that's laden with interruptions and competing priorities. There are many reasons why errors may occur, and it can be very difficult to find effective solutions to prevent them from happening again. Root cause analysis, or RCA, is a tool that's commonly used to identify the causes of errors so that corrective actions can be taken to prevent them from causing further harm. Unfortunately, traditional RCA tools were not designed for investigating the reasons why people make errors. They were designed to investigate the causes of equipment or hardware failures. As a result, traditional RCA has not been a very effective method to help reduce errors or improve patient safety. Indeed, numerous healthcare societies and patient safety professionals have called for a better approach for performing RCAs of patient harm events. But how does one go about transforming traditional RCA into an effective method of investigating and preventing errors? Do tools exist to fix this problem? Human behavior is complex. Where does one begin? Other industries such as nuclear power and aviation have had to grapple with these same issues. They have paved the way for healthcare. One of the best-known and commonly used methods for addressing human error across all industries is the Human Factors Analysis and Classification System, or HFACS, created by Drs. Doug Wigman and Scott Chappell. They studied thousands of accident reports to identify the types and causes of errors within the aviation industry. Using this data, along with other research, they developed an innovative framework for systematically conducting a thorough human factors analysis of airplane mishaps. Drs. Wigman and Chappell have received several awards, both individually and jointly, for their work on HFACS by major organizations such as the Flight Safety Foundation, the Aerospace Medical Association, the Aerospace Human Factors Association, the American Psychological Association, and the Human Factors and Ergonomics Society. HFACS has since become the global standard for investigating human error-related accidents across numerous complex high-risk industries. The developers of HFACS have now applied their expertise to healthcare and developed an HFACS framework and HFACS RCA toolkit specifically for the healthcare industry. Drs. Wigman and Chappell, as well as independent researchers at institutions such as Mayo Clinic, have published several studies on HFACS, showing its potential value for performing a root cause analysis of patient harm events in healthcare settings. Using a systems approach, the HFACS RCA toolkit allows investigators to gather and analyze information known to impact human performance, including the designs of tools and technology, teamwork and communication, tasks and procedures, and supervisory and organizational factors such as culture, processes, and resource management. The HFACS RCA Toolkit provides concrete user-friendly materials, including HFACS checklists, interviewing questions, diagramming tools, and causal factor templates. It also includes the new Human Factors Intervention Matrix, or HFIX, which facilitates the development of innovative corrective actions to solve issues identified during an HFACS RCA. With these tools, your RCA teams will be able to perform a more thorough and credible analysis of medical error-related events and will be able to identify more effective solutions. Ultimately, these changes will lead to improvements in patient care and satisfaction and will increase your health professionals' morale and professional pride in your healthcare system. Drs. Wigman and Chappell will walk your team leaders through state-of-the-art hands-on training of every aspect of the HFACS RCA Toolkit. Learn more about how your organization can use HFACS Healthcare to identify why mistakes happen and how they can be prevented from happening again. Visit us online now at www.hfacs-healthcare.com or contact us at info@hfacs.com.